Welcome to the Core Fitness Test. I'm physical therapist Brian Whitesides. Over the past 3 years, we have tested several athletes and developed a series of dynamic tests to comprehensively assess core fitness for running athletes. Most athletes are amazed at the results, discovering imbalances previously unrecognized. Athletes can then focus their training to restore balance and optimize performance. What exactly is your core? The core is a term used to describe the muscles around your hips, pelvis, and lower back. There are actually 29 pairs of these muscles that work together as the control center for your upper and lower body. Most tests for core fitness only assess the abdomen, neglecting 75% of the core. To fully test your core fitness, we'll perform a series of 6 endurance challenges. You will need an assistant, timer, tape measure, 10 pounds of ankle weights, and a horizontal Roman chair. We will now demonstrate the test series, and then you can perform them with the help of an assistant. Each challenge should be continued until you can no longer maintain proper form, cadence, or reach a difficulty level you would consider very hard. Stop if you experience pain. This challenge will test your hip flexor muscles. Attach 10 pounds of ankle weights to your right ankle. Lie on your back with your left knee bent and your right leg straight. Have your assistant position their hand 20 inches above your right ankle as a target for you to reach with your ankle. Keeping your leg completely straight, lift as many times as you can with a cadence of 1 second up and 1 second down until you reach a difficulty level you would consider very hard. Stop if you can't keep your knees straight, maintain cadence, or hit the target. Your assistant can help you maintain cadence and form, as well as tell you to stop when you break form or cadence. Record the number of lifts and repeat on the left side. The next challenge will test the muscles on the side of your hips, or hip abductors. Attach 10 pounds of ankle weights to your right ankle. Lie on your left side, directly against a wall, with your bottom knee bent, arms folded, and head supported on a pillow. Both shoulder blades and gluteals must be tight against the wall. Have your assistant position their hand 20 inches above your right ankle as a target for you to reach with your right ankle. Lift as many times as you can with a cadence of 1 second up and 1 second down until you reach a difficulty level you would consider very hard. Keep your knees straight, foot close to the wall and horizontal, maintain the cadence, and hit the target. Record the lifts and repeat on the left side. This challenge will assess the fitness of your lower back, gluteal, and hamstring muscles. This is a timed challenge. Position yourself facing down with the Roman chair supporting your thighs and feet securely. Allow your trunk to hang freely. This will be the start position and the point to which you need to return after each lift. Interlock your fingers and position your hands 6 inches from your chest. Start your timer and repeatedly raise and lower your trunk. Raise to the horizontal and return to the start position. As you come up, rotate slightly so that your elbow is just above your back. Maintain a cadence of 1 second up and 1 second down until you reach the very hard difficulty level. Record how long you are able to perform this challenge. Your last core fitness challenge will test your abs, as well as your hip flexors. This is also a timed challenge. Sit on the edge of the Roman chair with your sit bones over the edge of the support and your feet secured. Lean back to a horizontal position and gently swing your arms as if running. The arm swing should be relaxed and not result in trunk rotation. Time how long you can maintain the horizontal position without letting your back arch, and stopping at the difficulty level of very hard. Your assistant ensures that your back does not arch, assists in returning you to upright, and runs the timer. Record how long you are able to perform this challenge. After completing the core fitness test, you'll need to know how to interpret the results. We recommend that you first address any imbalances between right and left, and then focus on imbalances between zones. Let's look at Joe's scores to give you an example. Joe is a runner that was struggling with right knee pain. As you can see in Joe's test result chart, there's a slight difference in hip flexion, but this is less than 10%, so we don't worry about it. However, as you look at his hip abduction results, his right is only half of his left. Joe's first goal in his training program is to restore side-to-side symmetry. Using the hip abduction test for a strengthening exercise would be a great starting point. However, Joe will need to progress to more functional training. Next, we need to assess the balance between zones. Based on the results from athletes we have tested so far, this chart will give you an idea of what your strength levels should be for muscular balance between zones. Let's look at Joe's results. Compared to our target zone balance chart, Joe scored in the silver range on his hip flexion and posterior trunk zone, yet his hip abduction and anterior trunk zones were in the bronze range. Joe's next priority in his training program is to bring all of his scores into the silver zone. Again, the test position can be used for training, but remember to progress to functional training. Finally, running athletes can perform a series of tests to accurately assess their core fitness and design training programs specific to their needs. Run faster, cut quicker, jump higher, and be injury-free with optimal core fitness. Please visit betterrunner.com to post your results in our growing database. You will also find the target zone balance chart as well as DVDs for functional core training programs that are specific for running athletes.